Today, we will continue reading about the autoimmune diseases or the immune response to suppressing emotions, to not paying attention and giving the space that they need. And before we actually start with the reading, I like to say hi to you, hi on Instagram and hi on YouTube, and welcome you to make your questions and your comments. I received comments and questions, and this is wonderful because I really want this to be an ongoing conversation between you guys and this person that is here to serve you to the best of her capacities. My name is Angela Post, for those of you that do not know me, and we are reading The Myth of Normal by Dr. Gabor Maté, this amazing book, which is his latest work, and we are reading it and discussing it and gaining insight and clarity so that we can really support our healing journey. Last time, so the way we closed our latest transmission was noting something very important that I'll just like to bring back on this occasion. And it's about patient's agency and its impact on the overall healing process, because we have to communicate very openly and honestly between the healthcare professional and the patient, meaning that there has to be this sense of agency. There has to be this openness for the person so that the person, the client, the patient, whatever you want to name it, can open up, trust their intuition and insight, and can communicate this with the professional. And why is this important? Because healthcare professionals are here as people that provide a service in a loving way, in a respectful way, based on our own studies and our own experiences. However, if we don't make this mix with the person's insights and intuitions, we're lacking something very important in the healing journey. So this is an invitation to actually notice if you're a patient or a client, notice if you're able to voice yourself, to be able to voice to your clinician, to your healthcare professional, what you need to voice. And if you are on the patient side, also, let them know that there's this gut feeling from yourself and it's important for you to voice it out and verbalize it. And if you are a healthcare professional, or if you're watching this, also to open up to that possibility of communicating in a different way with the person you are in service for. It's going to make a great effect in the healing process. Now let's continue with the reading. Had Miok's doctors inquired along these lines when she presented her distressing symptoms? So just to recap, Miok, we were reading her case study the last time. If you haven't watched that video, I invite you to go to my YouTube channel or here on Instagram and just take a look at that. They would have learned that she had sustained 2 major abandonments by the end of her first year. She was born in Korea to a single mom who placed her in an orphanage when Miok was 6 months old. At 1 year of age, she was adopted and brought to the United States by an evangelical couple who reared her according to the strictest fundamentalist principles. Before Miok was 10, her adopted mother suffered a nervous breakdown. Sometime in her teenage years, her father, in a fit of religious remorse, confessed to her that she had sexually abused her for much of her early childhood, from age 2 onward. She had completely repressed these memories, secreted them, and associated feeling, pain, terror, rage deep beneath the surface of her awareness. As we will see later when we discuss healing, Miok's improbable recovery, veritably a deathbed resurrection, owed everything to her confronting this long-buried trove of hurt. This is so important. All the emotions that we have been repressing along our lives, if we don't address them, if we don't look at them with compassion, they're just going to keep staying there, buried inside of us. Upon the emotional graveyard of what she could not afford to feel, Miok erected an impressive edifice, a positive can-do persona that not only kept her from experiencing her despair and impelled her to ignore her own needs, number one, but number two, also helped her achieve success beyond what she really believed was her due. Isn't this interesting? In her job as an assistant to the world-renowned professor, the grown-up Miyok found her work stressful and would habitually bear the tensions and pressures of everyone around her. I was really not myself while I was there, she said. I was always having to operate as a more highly functioning person than I really was. When I started studying Gabor's work, this is one of the things that really grabbed my attention. And the reason is because even in my personal journey, if I may share, I've always been a very functional person, a straight, A student, and always being so hard worker. And then I made a connection of the amount of pressure that I was putting on myself in order not to deal with my repressed emotions. And the reason I'm just putting this out here is because if this is your case, there's nothing wrong for us being high functioning. There's nothing wrong for us working and doing the activities that we have to do or that we love doing. But it's always about, where is this coming from? Am I doing this out of a place of love and compassion, kindness to myself, service? Or am I doing this because I'm really, really avoiding feeling my emotions, feeling what has been there for so long, the pain, the remorse, the sorrow? There's two different venues to this, right? Let's continue. I was always having to operate as a more highly functioning person than I really was. Such hyper-functioning atop of hidden inner distress is a recurring theme among the many autoimmune patients I've encountered in my years of practice and teaching, says Gabor. Just prior to the onset of her agonizing joint inflammation, Miyok was in a complicated romantic partnership whose many ups and downs took a psychic toll and culminated in a wrenching breakup. Before I get into this, something came up and I wanted to share. Dealing with depression and anxiety, well, you guys know it's my focus, right? And the reason why I put it out there is because depression and anxiety, if you look into the biological markers of what's happening in the body, it has to do everything with inflammation. Inflammation doesn't build up from one day to the next. Inflammation builds up with time. It progresses with time. So if you're dealing with depression and anxiety, we also have to look into the body as a barometer, in a way, as a compass of telling us what has that inflammation brought us to our lives. So is it due to being highly functioning? Is it due to just avoiding the feeling itself? All of this are really pointers to the truth, and healing will take place. Now let's continue. All the lifelong hurt she could not allow herself to experience, all her terror of abandonment showed up in her reactions to the loss of the relationship. It was a full-body grief response. Once more, none of her history from childhood to present day was considered as admissible evidence by the highly trained experts who treated her scleroderma. My body was really like a battleground, and I was losing, Miyok told me. Her language resonated with me. I've long pictured autoimmune disease as resembling a powerful army invading its own motherland, a violent mutiny against the body. In effect, with no conscious outlet and lacking resolution, Miyok's inflamed emotions rebelled, manifesting in the inflammation of her tissues. So, how many emotions are there that we haven't really dealt with? And they're just flaring up in the body as a sign of inflamed emotions. Have you asked yourself that? These are questions that we put them out there for us to gain insight, for us to gain answers, and to move into an action plan. because one step of the journey is to gain insight, and another one, which is a very important one, and a lot of people miss this step, is to actually take action. Microbiologists these days speak of neurogenic inflammation, stress-induced inflammation triggered by discharges of the nervous system, a system we now understand to be powerfully influenced by emotions. And there is elegant research connecting early adversity, such as the traumas Miyake endured in childhood, to inflammation in adult life. A recent American study found that emotional and physical abuse in childhood more than doubles the risk of systemic lupus, with inflammation being one of the likely pathways. Yet more connections between stress and compromise onto autoimmunity have been found in other studies. In 2007, British scientists found that adults who had been maltreated in childhood had higher blood levels of certain inflammation signaling substances like CRP, which is C-reactive protein, produced in the liver, independent of personal behavior and lifestyle consideration. Childhood maltreatment is a previously undescribed, independent, and preventable risk factor for inflammation in adulthood, wrote the researchers. Inflammation may be an important developmental mediator linking adverse experiences in early life to poor adult health. They added cautiously. Many studies since attest that there is no maybe about it. Some clinicians have noted a relationship between rheumatoid arthritis and certain types or features of personality. Before we go into the aspect of personality that he's going to mention here, so personality is not that we're built up a certain way. From this perspective, the perspective of Gabor and the perspective of compassionate inquiry, personality is what gets built up across certain experiences. So if we are behaving in a certain way at the present moment, it doesn't mean that that's who you are. And it doesn't mean that this is the person you're always going to be. This is a lie. And we need to challenge that belief. We need to understand that the way that we've been behaving has been a directly impact from the way we were raised, the way we were interpreting informations and situations, either in making it trauma or no trauma. And this all shapes up the personality. We will have much more to say about personality in chapter 7. I probably just, added something in advance. But to avoid misunderstanding, a quick clarification is in order here. What we call the personality traits, in addition to reflecting genuine inborn temperaments and qualities, also express the ways that people as children had to accommodate their emotional environment. They reflect much that is neither inherent nor immutable about a person, no matter how closely identified he or she is with them, nor their character faults, though they may cause us difficulty now, they began as modes of survival. Exactly what I was saying. As far as back as 1892, the Greek-Canadian-born John Hopkins physician William Osler, later knighted by Queen Victoria for his contributions to British medicine, had already noted the association of the disease with shock, worry, and grief. Many years later, in 1965 survey reported the prevalence of rheumatoid arthritis-prone individuals of an array of self-abnegating traits, a compulsive and self-sacrificing doing for others, suppression of anger, and excessive concern about social acceptability. An unusually perspective Canadian specialist in autoimmune disease, Dr. C.E.G. Robinson, wrote in 1957 that his patients with RA usually try very hard to please both in professional and personal contexts, and either concealed hostility or expressed it indirectly. Many of them were perfectionistic. The onset of disease was often preceded by stress, he added sagely. Frequently, as much time is needed for dealing with the emotional problems of the patient with chronic rheumatoid arthritis as with the joint or systemic disorders. I think the emotional psychological aspect of many rheumatoid patients is of first importance. 4 decades after Dr. Robinson published his comments, American researchers likewise found that the degree of interpersonal stress was correlated with disease severity among a group of women with RA. A case in point is 42-year-old Julia from one of Canada's prairie provinces, diagnosed with rheumatoid arthritis at the age of 29. She had been rear-ended in a motor vehicle accident and the next day felt some pain in her left shoulder, which quickly resolved, only to flare up again and again in various joints throughout the body, migrating with bewildering unpredictability. It would show up in a joint and then leave, she told me. Then all at once, I ended up with 26 joints that were all inflamed simultaneously. Blood tests found one of the indicators of rheumatoid arthritis highly elevated, clinching the diagnosis. Her emotional profile aligned with the hyper-responsible, anger-suppressing persona described in the literature, traits she developed in a family of origin with an alcoholic father and an emotionally dependent mother to whom she could not devote her sexual abuse at the hands of a family friend, who also victimized a younger sister Julia tried to protect. None of Julia's treating physicians ever asked about her inner life. Why does that matter? Because such personality patterns, as Dr. Robinson's and others have observed, are reversible, and with them, so may be the disease. I'm going to repeat this again. None of Julian's treating physicians ever asked her about her inner life, her experiences, her situations, her past. Why does that matter? Because the personality patterns, as Dr. Robinson and others have observed, are reversible. And with them, so may be the disease. Despite having been told the illness will inevitably progress, Julia is now symptom-free and medication-free. I have beautiful conversations with my rheumatoid arthritis these days. Makes me want to cry telling you, she said to me. I'm great. What could such a statement mean? And why so deeply felt in Julia's case? We will return to these beautiful conversations later when we look at healing. I'm gonna stop the reading at this moment, and I wanted to end with this high note. If we understand that, number one, personality is not something that we cannot change, it's something that emerges as a pattern of survival, we can understand that many diseases, a high percentage of diseases, are also reversible. Because if we are adapting to our situations, to our interpretations, then the actual disease is flaring up because of the same interpretation and of the same situations. So it's completely reversible. And when we have this understanding, this not only gives us hope, it gives us a sense of responsibility. If you're listening to this video, if you're listening to this content, it means there's something inside of you that is telling you that you resonate with this information. And the fact that you are here watching this and commenting on my videos is telling you that you have all the possibility to really, really gain control back of your life, heal, and become that wonderful person that you're meant to be. If you are experiencing depression and anxiety, it does not have to be this way. It is a healing process, and I will be more than happy to be part of the journey if you choose me as your therapist. With that being said, I wish everyone a beautiful weekend, a beautiful Friday. Keep healing, keep reading, keep connecting, and I'm gonna send you a big hug. Take care. Bye-bye.